Hello, everyone. I'm Charlie Revis, president of Dysphonia International, and I want to welcome all of you to our webinar today. It's titled Mindfulness for People with Voice Disorders. Just a couple of housekeeping items. The webinar is being recorded and will be available on our YouTube channel and our website, dysphonia.org. I want to encourage you to ask questions, and you can submit them by typing into the Q&A box on your Zoom screen. And again, I'll just emphasize, please put your questions in the Q&A box, not in the chat room. And we will answer as many questions as time permits. However, I want to assure you that we will get answers to all of your questions, and they will be made available as part of the webinar and included on the website, again, dysphonia.org. I'm extremely pleased to introduce our guest speaker, who is Catherine Brown. Catherine is a trained mindfulness teacher, experienced singer, voice instructor, and she has her own voice disorders. Her online group classes are based on the mindfulness-based stress reduction model established by John Kabat-Zinn. The classes are adapted specifically for the needs of people with voice disorders and healthcare professionals who treat voice disorders. Her curriculum has been tested in a research study of mindfulness in people with voice disorders, and the results of the first phase of that study were presented as a poster at the Voice Foundation Symposium in June of 2023. And Catherine has been diagnosed with vocal fold paresis and muscle tension dysphonia. So, Catherine, I will turn the program over to you.
Thank you. Hello, everyone. I'm going to pull up my slides now, and we will get started. Let me just put these in slideshow view. So, a little bit about me. I am a singing teacher. I'm an adjunct voice instructor. I've been diagnosed with 3 voice disorders, so vocal fold paresis and sulcus. Sulcus is scarring on the vocal cord, both of which are permanent. And I also was diagnosed with muscle tension dysphonia. So I've had vocal fold paresis twice, 20 years apart, each time after the flu. The first time it was just on one side, now it's on both, so bilateral paresis. And the first paresis led to a secondary diagnosis of MTD, muscle tension dysphonia. And I believe mindfulness was an essential part of my recovery from MTD. And that got me curious about whether mindfulness would be able to help other people with voice disorders. So I pursued a graduate certificate in applied mindfulness at Westchester University. And as part of my studies, I led a research study on the effects of mindfulness in people with voice disorders. And my article was published in November in a peer-reviewed preprint in the Journal of Voice. I will link to that at the end. It's 13 pages with 48 footnotes, so if you would like to read the academic study, you may. But I'll summarize the results here if you would like a shorter version. So what we'll be going over today, we're going to start by answering the question, what is mindfulness? We will talk about exactly how mindfulness can help people with voice disorders. And then we're going to do a body scan together. After that, I will talk some about my research and do an overview of that. And then I'll share some links to some resources for people who are interested in pursuing mindfulness. And we will leave time at the end for the Q&A. So, to our question, what is mindfulness? So there's a famous quote by John Kabat-Zinn. He's sort of the the founder of mindfulness in the context of medical interventions. And his quote is, mindfulness is awareness that arises through paying attention on purpose in the present moment, non-judgmentally. So let's unpack a little bit of how this ends up looking when we practice mindfulness. Mindfulness meditation encourages us to focus our attention on anchors like the breath, the sounds around us, the sensations that we feel in our body. It requires us to step away from our fast-paced world and just tune into what's going on in the present moment. So as thoughts or anxieties arise, we just return our attention to our anchor. So whether that's the breath or something else that we choose to focus on. Mindfulness encourages what we call somatic awareness. So this means awareness of the body. And I think that can be particularly helpful for people with voice disorders because we often hold tension in our throats, but we also hold tension other places in the body as a way of compensating for whatever's going on in our throat. So noticing that tension can really make a big difference. Yoga is a mindfulness practice, and yoga is always part of a mindfulness-based stress reduction type class. And the yoga that I include in my course targets places where people with voice disorders tend to hold tension. And I worked with a yoga therapist who specializes in voice disorders to develop the program that we use as part of the study. So how can mindfulness help people with voice disorders? So research tells us, and my study has certainly confirmed, that people with voice disorders often experience high stress levels, physical tension and pain or discomfort, social and emotional isolation, and loss, particularly of work opportunities, sense of self, and ability to communicate. So let's break each of those down and look at how mindfulness can help us respond to those things. Whoops, sorry, just skipped a whole bunch of stuff. So for people with voice disorders, stress can be a causative or exacerbating factor. So it's not typically a sole cause of a voice disorder, although it's possible for it to be, but it can often exacerbate the voice disorder. It can make the voice disorder worse, and it can get in the way of treatment, right? If we have a lot of tension, it's hard to create vocal change as a part of voice therapy. One study found that voice disorder patients had similar stress levels to those of outpatient cancer patients. So outpatient cancer patients, people who are not hospitalized for their cancer, but were seeking treatment as outpatients. Mindfulness can help us learn how to respond differently to stress. So it may not reduce the stresses we're experiencing, but it helps us respond to them in a way that makes life a little easier. Tension and discomfort. Voice disorder patients frequently experience physical tension and discomfort in their throats. Muscle tension dysphonia is a pattern of tension in the larynx that negatively affects the voice. And mindfulness has been shown in other studies to help patients release tension and reduce chronic pain. I believe this can often be true for voice disorder patients who experience chronic pain. Some voice disorder patients have chronic pain elsewhere in their body, but a lot of people have pain in their throat when they speak as part of their voice disorder. Isolation. Many voice disorder patients, particularly those with rare or severe voice problems, do not know anyone else with similar struggles. In a mindfulness-based stress reduction class, the group format helps participants feel less alone. And my experience is that voice disorder patients love talking to other voice disorder patients. They love hearing people who sound like them. And, for people who are part of Dysphonia International, you often have already had the experience of talking to people who sound like you. because, this organization connects people. But for people who aren't aware of Dysphonia International, often they've never heard someone else with their voice disorder or with a voice disorder at all. So that can lead to greater acceptance of the voice disorder, which can increase quality of life. And then finally, loss. So people with voice disorders often experience feelings of grief and loss around their vocal limitations. And these are heightened in professional voice users, and that means anyone who uses their voice for their work. This doesn't just mean professional performers or actors or singers. So, anyone who uses their voice for their work, which is most people, can experience a loss of professional and personal identity, income, or even their career. And one of the wonderful things about mindfulness in this context is that it encourages what we call reappraisal. So this is a process through which we reframe the meaning of adverse events to alter their emotional impact. And we end up talking about this a lot in my voice disorder classes. Whoops. So from there, we are going to do a body scan. So normally in my classes, this would be about a 20-minute exercise. You can also do much longer body scans, 30 or 45 minutes, but for the purposes of our presentation, we're going to make it 20 minutes and, 15. We're going to make it 15 minutes. So this will be a slightly shorter version of it. I encourage you to get as comfortable as possible. If you need to grab a pillow, if you want to grab a blanket, go ahead and do that. If you're uncomfortable, you're going to be focused on that. So get as comfortable as you can. And then you can do this lying down. It typically is done lying down. So if you'd like to lie down, if you can do that and still hear me, that's great. You can lie on the floor, you can lie on a couch or a yoga mat, but you can also do this sitting up, whatever feels comfortable for you. I will lead it sitting up so you can hear me well. So go ahead and get comfortable, and then we're going to just start by closing your eyes if you feel comfortable doing that, just to reduce distractions. Sometimes I like to cover my eyes, just with a cloth or something like that to just kind of help me really move my focus internally. And you're going to start just by noticing your body as a whole. Just kind of checking in with your body. You may notice some spots of tension. You may notice some fatigue or restlessness. If you've just sat down, you might feel some energy kind of coursing through you. So just checking in with your body, noticing how it feels in this moment. And now you're going to direct your attention to your breath. Wherever your breath feels most present to you, you might notice it in your nostrils, in your throat. Perhaps you feel your chest rising and falling, or your belly, your abdomen moving up and down with each breath. And remember, we're just noticing the breath as it is. We're not trying to change it in any particular way. We're simply noticing it as it already is. And now we're going to direct our attention to our feet. Just noticing how your feet are positioned, if they're flat on the floor or you're lying down, your heels are touching the floor. Just noticing where you feel the touch of a surface beneath your feet. You might notice the pinch of shoes or notice the temperature of your feet. And sometimes people find they don't really feel much in their feet. That's fine too. You can just notice the not noticing. And now we'll direct our attention towards the calves. And the knees. And now noticing your thighs. Just scanning your legs for whatever you feel there. Any discomfort, any tension, any restlessness. Perhaps the touch of clothing or fabric or whatever surface you're sitting on. Simply noticing what is in the present moment. And now, on your next inhalation, taking in air, and as you exhale, feeling your feet and your legs sink into the surface beneath you. And directing your attention now to your pelvis. If you feel any discomfort there, you can shift a little bit in your seat or on the surface you're lying on. And directing your attention now to your lower back, noticing that, for some people, this is an area where we tend to hold tension. So approaching it with gentleness. And directing your attention to your mid-back, your upper back, particularly noticing the shoulder blades and how they interact with whatever surface they're touching. And now we'll direct our attention to the front of the torso, to your abdomen, to your chest, and remembering our goal is not to change or fix anything, but just to notice what already is. And noticing it to the degree that we can without judgment. And now on your next exhalation, seeing if you can feel yourself releasing any tension to the degree that you can in your torso and pelvis. And now we're going to direct our attention to the neck. And I like to talk about the neck and the tongue and the jaw all together because they're very interrelated. So as we approach this area with our attention, just acknowledging that for many of us, this is an area where we may feel discomfort, and it's an area where we may feel a lot of emotion. So if you do feel any particular emotions coming up for you, just noticing what they are and allowing yourself to feel those. So noticing now the front of your neck. And if you feel any tension, discomfort, or pain there, seeing if you can simply notice it without trying to change it. Again, in mindfulness practice, we're not looking to fix anything. We're just noticing what is. And this can be very difficult if we don't like what we feel. You might find yourself resisting the idea of just noticing what is or accepting what is. And if that's the case, just noticing that resistance. You don't have to let go of that resistance, particularly if that feels challenging. So we're noticing what is physically and we're noticing what is emotionally. And now direct your attention a little higher to the base of your tongue. So this is basically your chin, just under your chin bone. And just noticing your tongue, how it feels in your mouth. And noticing the jaw as well. And now, as you exhale, seeing if you can feel this area release to some extent. This may not be an area where you're going to feel complete release. It also may not be an area where you experience tension. But just seeing on the exhalation if you can feel any kind of release here. Allowing tension to exit the body with the exhalation. And now directing your attention to your cheeks, your eyes, your forehead, the top of your head, the back of your head, and the back of your neck. And once again, we're on the exhalation. We're just going to imagine that we're filling your head with air, and then we're releasing any tension on the exhalation. And now we're going to do the same for the whole body. As you inhale, imagine that you're filling the entire body with air. And as you exhale, imagine that you're releasing any tension there. And once again, we will focus our attention on our breath for several cycles of breath. And finally, just noticing the body as a whole, checking in like we did at the beginning, and noticing if anything feels different in your body after completing this body scan. Sometimes we feel more relaxed. Sometimes we feel more aware of places that we have tension that we hadn't noticed before. Sometimes we fall asleep. Just noticing whatever it is you feel now in your body as a whole. And then gently moving your hands and feet, opening your eyes, and returning your attention to Zoom. So normally at this point in a mindfulness class, we have a discussion. We'll skip that today, but we would have a discussion about what people noticed in their bodies, what emotions came up for them during the body scan. Sometimes people have difficult experiences during a meditation. There may be, difficult emotions that come up, or they may have experienced pain that maybe worsens during the body scan. Whatever comes up, we can talk about that and talk about, some ways to work with that, to work with discomfort, whether it's physical or emotional. So those are all things that would happen. Or in a Zoom setting, we might do breakout rooms. So you would be partnered with someone and you would talk to them about your experience with the body scan exercise. So that's normally what would happen next in a mindfulness class. However, for the purposes of this presentation, we are going to move on to my research. So I'm going to talk a little bit about my research study, how it worked, and what we found. So the study, the objective of the study was to determine whether an 8-week mindfulness course could increase mindfulness and lower stress in people with voice disorders, leading to a decrease in vocal handicap. I'll talk in a second about exactly what vocal handicap means. So we recruited subjects with voice disorders for this course, and it's modeled after the mindfulness-based stress reduction curriculum. I'll talk in a minute about what that looks like, but it's a protocol that's used often in patients who have chronic pain or any kind of chronic medical condition. And so, it's been studied for people in people with cancer or fibromyalgia or sleeping issues, depression, all sorts of things, but no one had ever studied the 8-week mindfulness course in people with voice disorders. So before and after the 8-week mindfulness course, we had people take several questionnaires. The Mindful Attention Awareness Scale, so that kind of measures your level of mindful awareness. The Perceived Stress Scale, which measures how much stress someone perceives to be in their life. And the Voice Handicap Index, so that's usually if you go to a laryngologist or a voice clinic, they have you take this. It basically is a self-report measure of the way the way your voice shows up for you in everyday life. So what your voice symptoms are, how functional your voice is as far as how you need it to be used, and whether it's working for you. And there's also an emotional component that measures someone's emotional response to their voice. Sometimes someone may not have super severe symptoms, but they are very emotionally affected by, their voice issue. So that's an important piece of it as well. And then the Singing Voice Handicap Index is basically a version of the Voice Handicap Index that's designed specifically for the needs of singers. Some people in the course self-identified as singers, and so we had them take that as well. Those who did not self-identify as singers did not have to take that questionnaire. And then when the mindfulness course was over, we conducted interviews with some of the participants. So this just gives you a quick idea of what the mindfulness curriculum looks like. So it takes place over 8 weeks over Zoom. Participants are given 6 mindfulness recordings that they practice as homework. So ideally they'll practice, each one is about 20 minutes. Ideally they'll practice daily, but we don't track, we didn't track, and mindfulness courses typically don't track how much people practice. They're given 5 yoga videos. One of those is used as homework. The other yoga videos are just extra videos of yoga exercises that we do in the class. And then they get a PDF of resources. That PDF is now on a website, so you will get that at the end of this course. It will be one of the links that we provide you with. So we start out with an introduction to mindfulness, class expectations, basic, tenets of what mindfulness is. And basically the first class is people introducing themselves to each other. People talk about their voice disorder, how it affects them, what they're hoping to get out of the class. And usually there are some tears every time. There are some tears because people don't usually commit to an 8-week mindfulness course unless there's something hard that they're going through. It's a big commitment. The second class, we talk about mindful awareness in everyday life. So ways that you can be mindful in your everyday life outside of the formal meditation practices or yoga practices. Class 3 is about deepening somatic awareness. So, tuning into your body, really noticing your body. Class 4 is about responding to stress. This is particularly helpful for people who find their voice disorder very stressful or find other people's reaction to their voice very stressful. And the same with the next class, class 5, recognizing emotional reactivity. So that's kind of, noticing how we respond emotionally to positive or negative events in our lives. And how that emotional reactivity affects our health and our voice. Class 6 is working with discomfort. That's particularly helpful for people who have pain, physical pain, but emotional challenges as well. So we work on, we start at that class to talk about accepting the voice disorder as it is. And that's a really hard topic. People will often say, I don't want to accept my voice disorder. I want to fight it. And one of the things that we often talk about is acceptance is a very active process, not a passive process. And that you can still be doing everything medically or therapeutically to fight your voice disorder and also be accepting it as it is. And that when we resist what is, we are kind of fighting with our own body. And that can lead to some extra tension, psychological, but also physical tension. And then the 7th class is building your mindfulness practice. So starting to, practice more independently. And then the 8th class is all about resources. Again, you'll get a link to those resources that have, a bunch of different mindfulness exercises that you can, look at and that kind of thing, or practice. So that's what the curriculum looks like. So let's see who participated in the study. So we had 2 groups. We had a mindfulness group and we had a control group. So the mindfulness group were the people who, they took their questionnaires, they did the 8-week mindfulness course, they took their questionnaires again. We had 36 women and 3 men complete the mindfulness course. And then we had a control group. So this was what we call a waitlist control group. We had 30 people, 25 female, 5 male, who were assigned to the waitlist control group. They took the questionnaires, waited 8 weeks, living their regular life, no mindfulness course during that time. And then they took the questionnaires again. They then had the opportunity to do the mindfulness course after that. But the data that we used for them was from the for this study was from the control period. You will notice that the participants skew female, very strongly female. There are a lot of reasons for this. One, women are more likely to get voice disorders than men. There are a lot of reasons for that. And I won't go into that. If you read my study, you can find the link to my reference there. But women are more likely to, we think women are also more likely to seek treatment for a disorder that is psychologically difficult. And we know that women are more likely to seek mindfulness as a health intervention. So those are 3 pretty strong reasons why this study skewed very strongly female. So you will see here in this chart, this tells you the disorders that we saw, and I'll just tell you what these mean. So the dark line, the dark purple is the mindfulness group, and then the light purple is the control group. So by far, muscle tension dysphonia was the most common disorder. Let's see if I put my, oh no, I can't see it. Okay, so it was something like 19 people with muscle tension dysphonia in the regular group and 15 in the control group, for example. The second most common was spasmodic dysphonia. Then vocal fold paresis / paralysis. We put those into one group. So yeah, fairly even numbers there. In the mindfulness group, we had, I think it was 4 people with essential vocal tremor, 3 people with vocal fold cysts, and then the other category was other. So there was some random unusual ones in those categories. And I think a few cases of vocal nodules as well. So those are our demographics. I have more information on that in the study if you want to look at things like age and all of that. The quantitative results. So again, this is your most basic information. If you want, p-values and statistical significance, you can look at the study. So what we did is we ran 2 statistical analyses. We compared the mindfulness course participants to themselves before and after the course. And when we did that comparison, all outcomes changed significantly in the direction hypothesized. So what that means is their mindfulness scores went up, their stress scores went down, their vocal handicap scores also went down. So that's one type of statistical analysis. And then you do a different type of statistical analysis when you're comparing change in one group to change in another group. So this is the comparison of the mindfulness group to the control group. So when we did that analysis, only 2 outcomes changed significantly in the direction hypothesized. So the mindfulness scores went up and the voice handicap index scores went down. We did not see statistically significant changes to the stress scores or the singing voice scores. And I'll talk a little bit more about that, about why we think that might be in a moment. Okay. Just checking to make sure we're on track time-wise, and we are. So this just shows you a little graph here of the voice handicap index scores. So this is a comparison of the mindfulness group, which is the dark purple, to the waitlist control group, which is the lighter magenta. So if you look here, you'll see that the mindfulness group has a significantly, bigger slope there. So that is, their scores went from 62.3 on the voice handicap index If there are any speech language pathologists in here, let me just remind you, this is the full voice handicap index, not the VHI-10, to a 51.5. The control group had a slightly higher VHI. That's not a huge difference, but they didn't go down very much. And that those changes were not considered statistically significant. The change from the 71.1 to 67.3. But these changes for the mindfulness course are statistically significant. So I'll just say here, the mindfulness group saw a nearly 11-point decrease in VHI. On average, voice therapy results in a 13-point decrease in VHI. Now, this is important to note that I believe everyone in the course had already gone through voice therapy before participating in this course. So, you will also notice if you look at their vocal handicap index scores. So 0 to 30 is mild, 31 to 60 is moderate, 61 to 120 is severe. So the mindfulness course participants were starting at 62.3. So they're starting at the bottom of the severe category on average, and on average they went down to around the middle of the middle-high moderate category. So that is a pretty significant change, and just noticing how high people's VHIs were to begin with indicates that we were working with a population that had chronic voice disorders, chronic and somewhat severe. Your average person who goes to a voice clinic, they go through 8 weeks of voice therapy and they're fine. They're back to normal or very nearly normal. These, were typically patients who were not back to normal after doing voice therapy. Some of them had done, many, many months or even years of voice therapy. So an 11 point decrease in VHI is actually quite significant. And then we followed this up with interviews with the people who experienced the largest changes in their voice handicap index, because one of the things that I wanted to know from people was, okay, you went from the middle of the severe category to the bottom of the severe category. Is that a difference that you notice in your life? And it definitely was for everyone that I interviewed. So in follow-up interviews, participants expressed experiencing increased somatic awareness. So one quote was, "My biggest takeaway is noticing when I start to feel tense." They experienced reduced physical tension. The overall level of physical tension has definitely gone down. Fewer vocal symptoms. So one person said, I noticed a stronger voice and also fewer spasms and greater vocal clarity. Another person said it was easier to sing. I was able to sing high notes. And then I started to feel a greater sense of control in my voice. People experienced an increased confidence while speaking. My voice just sounds a little more confident, and increased acceptance of their disorder. Quote, "Mindfulness helped me feel more accepting of having the disorder." There are a lot more quotes in the article if you want to read more. So some conclusions, and I know you'll have some questions about some of these things, so let me just quickly go through a few things. First of all, we suspect that somatic, or what we call interoceptive awareness, may play a larger role than stress reduction in vocal improvement. And this is really interesting because any textbook that you read on voice disorders, almost any textbook, trust me, I checked a lot of them, will say that stress reduction is really important in maintaining vocal health and in recovery from a voice disorder. And we found in this study that people's stress scores didn't change very much. So we think that somatic awareness, being aware of the body, may actually play a bigger role than we've previously acknowledged. We also noticed that certain patients, for example, those with moderate to severe VHI scores, seemed to benefit the most. We had a number of people who had very low VHI scores, particularly people who were professional level singers. And the people with the lower scores didn't see as much change. Now, that is just an observation. The study was too small to divide people up into, moderate to severe or versus moderate to mild. I did try doing that, but there were just not enough participants to be able to divide them up that way and still get statistically significant results. Conclusions. So it's just too small to say for sure, but almost everybody who I interviewed was in the moderate to severe category and saw a large drop in VHI. Some of oh shoot, I went back to the other slide. How did I do that? Sorry. So the other thing we noticed as well, and again, it's too small to draw statistically significant conclusions, but several of the patients with really dramatic drops in VHI, so 20 to 30% decreases in their VHI, were patients with muscle tension dysphonia. So this leads us to think that, somatic awareness is leading to a decrease in muscle tension. And the same is also true for patients who experienced pain. I think I'll talk about that in a second. Patients with spasmodic dysphonia seem to benefit less vocally unless they also had muscle tension dysphonia. But the SD patients were the ones who seemed to benefit the most psychologically. Some of the SD patients were people who had never talked to anyone else with spasmodic dysphonia. So being in a group with other people with that disorder was life-changing for them. It was very emotional for them. And I will also add that, a mindfulness course is not the same as a support group. In a support group, you're just there to support each other emotionally. In a mindfulness group, things go a little bit deeper in some ways because you are there to learn specific tools that help you respond to your disorder differently. And that's the area where people with spasmodic dysphonia saw a lot of change. They were able to view their disorder differently. They were able to view themselves differently after practicing mindfulness with other people who also had spasmodic dysphonia. And just the more acceptance of the disorder. Participants repeatedly expressed that they had no support system when they were discharged from voice therapy. A lot of them felt they had failed voice therapy because they continued to experience voice problems. And we think that, mindfulness helped people address some of the physical manifestations of the disorder, particularly tension and pain, while also addressing some of the psychological fallout, grief, loss, isolation, anxiety, or embarrassment about their voice disorder. And of course, I have to add, some participants did not see any vocal benefit from the mindfulness course. And, you can never guarantee any particular health outcome from a mindfulness course. Okay. So a few things, I am going to be offering mindfulness courses in the future. We're going to have one starting in February. There's a link for that. I believe they're going to put the link, all of these links will be in the chat. If you want to sign up for my email list and get notifications on future mindfulness courses or any other offerings, you can do that. If you would like to read the article, 13 pages, 48 footnotes, it's here. You can, right now and until the middle of January, you can download the entire PDF for free at this link. Beginning at some point in January, you will only be able to get the abstract. If at some point you want the full thing and you forgot to download the PDF, go to my website, send me an email, I'll send you the PDF. And then we have a link of mindfulness resources. Guys, this is a huge collection. This is me as a mindfulness teacher curating what I consider quality sources. Some of these sources are specifically related to voice. Some of them are just related to mindfulness. There is a ton of stuff on there. So if you want to get started practicing mindfulness on your own, this is a great opportunity. There are a lot of free resources out there. But I will also say there is a huge difference between practicing mindfulness with an app on your own and practicing mindfulness in a group, in community with other people, with your condition, and with a trained mindfulness teacher who can kind of facilitate and help you work through any issues that arise. But there are many wonderful resources out there for free as well. I am now ready to take questions.
Okay, Catherine, great presentation and interesting information for sure, and certainly some interesting data coming out of your study. We will just hit some of the questions that we have time for here. One is, has mindfulness been effective with the changes of an aging voice? By these changes, I mean loss of control in the middle voice for singing, loss of upper range, and freedom in singing.
That is an excellent question. That's not something we looked at. So I cannot answer that directly, but I can guess. My guess would be that it's not particularly helpful. In the sense that, a lot of times what an aging voice needs, particularly, as a singing teacher, you're going to need strengthening exercises. But here's where mindfulness could be really, really helpful. Any aspect of aging can be hard emotionally. I'm 44, so I'm, kind of getting there. And I think that mindfulness can help with that sense of loss. But I don't think you're going to see, I don't think you're going to directly see a change in symptoms. I think you're going to see a change in your relationship to your voice and the way you feel about your voice, but not necessarily, symptoms that just magically go away.
Excellent. Good information and good advice. Interesting question. Do you use mindfulness to supplement medicinal treatment or treatments designed specifically for people experiencing vocal paresis? Or has your voice improved with mindfulness techniques only?
Me, personally?
Yes.
Is the question directed at me?
I think the person is asking you, yes.
Okay, yes. So here's what I will say about that. So I experienced vocal paresis for the first time when I was 18, just about to audition for college. And I got a terrible flu and my voice was never the same. I lost like 1.5 octaves of my upper range. The tension, and then I think I basically gradually developed muscle tension dysphonia over the next 10 years. It took 10 years for me to get the diagnosis of vocal paresis, but my voice never recovered from that. Then once I got that diagnosis, I went to voice therapy. And at the same time, I started taking this mindfulness course. So I started voice therapy. I did maybe, a year. I did 4 years of voice therapy before I felt that I got my voice back. Okay, this is 4 years of singing voice therapy, guys, along with some speaking voice therapy. The speaking voice therapy was only maybe a few months. By the end of that time, I felt that I no longer qualified for the diagnosis of muscle tension dysphonia. But I will tell you, for those of you with severe muscle tension dysphonia, mine would have been considered mild. It greatly affected my singing voice. I was so tense, my throat would hurt when I sang. But, I could always talk. I never lost my voice. I never had times of my voice just not functioning at all. And I gained a lot of range back. And I think that was a combination of working on the muscle tension dysphonia through the mindfulness and through voice therapy. And I really feel that, now that I know more about it and my paresis has gotten worse, I think the voice therapy that I went through at that time was mostly entirely focused on muscle tension dysphonia, because that was my strongest symptom. Yes, my vocal cords were not fully coming together from the paresis, but I had so much tension, 10 years of tension. and I had no clue during that time how to relax it, Mindfulness really gave me tools to just figure out how to relax muscles that just did not want to chill out. So that's a long answer to your question. I hope I got it all. Later, when I was when my paresis happened again, I was pregnant 20 years after the first one, and I got paresis again. It affected both vocal cords, so instead of just being on the left side, it was on the left and the right. It was much more severe, and they did not give me a diagnosis of muscle tension dysphonia. So I do not think that mindfulness has changed the paresis for me. I don't think my paresis is any less as a result of mindfulness. What mindfulness has really helped me with is accepting the paresis and the limitations. Because once I went through rehab, and then, there was a long time where I was able to perform. I became a voice teacher. I was able to teach. And then once I got that second paresis, I stopped performing. So mindfulness helped me adjust to life as a voice teacher who no longer performs.
Excellent input, Catherine. Here's an interesting question. Do you have any speculation on how a mindfulness course implemented at the time of voice therapy might have a greater improvement on people's voice quality, and any tips for an SLP to implement mindfulness into voice therapy sessions?
Yes. So we have so many thoughts. I have so many thoughts on this, and I say we because I'm now partnering with Julia Gerhard at Miami University of Miami's Voice Center. She's an SLP and singing voice specialist, and she's very interested in mindfulness and how it can help people with voice disorders. We absolutely think that mindfulness would be more effective if it was done at the time of voice therapy. I think that someone going through voice therapy and a mindfulness course simultaneously over an 8-week period would get the best bang for their buck in the mindfulness and the voice therapy. They go hand in hand beautifully. So my partner Julie and I are working on an article specifically on how voice therapists can incorporate mindfulness into their work. For the most part, we are not recommending that voice therapists take time out of a voice therapy session to do a 20-minute body scan, or even a 15-minute body scan, or even a 5-minute body scan. There's too much else you have to do in the therapy session, but we would strongly recommend that you assign it as homework. And if any voice therapists have more questions, please go to my website, send me an email. We have a poster on this. I can send you our poster as a PDF. The article is not ready to be, the article has not been published yet. But we do have the poster, and we have specific mindfulness exercises that we think work specifically for certain populations. And there are also times when mindfulness is contraindicated. So that's something that's important to know as well.
Bit of a follow-up to that, Catherine, is any of the mindfulness courses covered by insurance?
I am not aware of any times when mindfulness is covered by insurance. That's a great question. The best I can say is that there are some sort of self-guided mindfulness courses out there that are free. There are, there is an exception. Laura says here, it is covered in therapy. My insurance covered it. It may be covered, yes. In the UK, it is covered for certain conditions. No one's covered it for voice, no one's looked at it. Okay, so this person said it's covered in therapy. There are therapists who use mindfulness in their practice, not voice therapists, but psychotherapists. So it could be covered in that context. As far as an 8-week mindfulness course being covered for certain conditions like anxiety or depression, I don't know. I am sure that it's not covered for any voice therapy purposes because no one's ever studied it before this. So yeah, it wasn't therapy, it was for mental health. Exactly. So it may be for mental health. So if you have a mental health condition, you may be able to get it covered for that, and it may have benefits for mindfulness. And I will also say there is a lot of evidence that people with voice disorders tend to also have certain mental health conditions. Whether this is causative, what causes what, we don't know. But there's some research around those questions that's very interesting.
Okay. This person is wondering how to maintain upright posture in meditating with preventing slouching while also keeping the neck, jaw, tongue relaxed, and what areas to feel related to muscle tension dysphonia.
Yeah, so my solution to this is to meditate lying down. If I sit up, I get tension for long enough, I get tension in my back. So I like to do my meditations lying down, even a sitting meditation. It's called the sitting meditation because you're supposed to do it seated. There's no reason why you have to sit up to do a sitting meditation. I prefer to do it lying down. I find that my throat relaxes more when I'm lying down. If you tend to have acid reflux, you can lie on a wedge pillow, you can lie on a recliner. The other option is lots of pillows. I felt my back tensing up just doing this meditation because normally I put a pillow behind me, but I don't want to look weird on Zoom, so I didn't put a pillow behind me. Do whatever it takes to get physically comfortable in any situation, whether you're meditating or working at your desk. If you need pillows, if you need a special chair, go for it. There was a second question about MTD, I think, that it was something about where people feel tension if they have MTD.
Right.
I mean, it can really vary. For a lot of people, it's right here. For me, it's right here. But some people will feel more tension in the back of their throat. Some people will feel tension in the base of the tongue, which is right here. If you have a voice therapist, they can walk you through a routine of vocal massage. Actually, there's a YouTube video on my resources page of vocal self-massage, how you can, where you can massage yourself for muscle tension dysphonia. So that's actually really helpful.
Okay. Interesting question. This person is asking, have you had any ALS patients in your mindfulness course? And if so, did the course help them?
We did not have any ALS patients. I will say, though, a lot of times people with voice disorders have other conditions. We did have someone with Ehlers-Danlos syndrome, which is a connective tissue disorder that tends, people with that condition are more prone to voice disorders because of the instability of the larynx that's caused by that. So we did have someone with that. It was extremely helpful for her. She went from basically having something like 3 days a week of no voice to having 2 days a week of no voice, which sounds like, oh gosh, she still has 2 days a week of no voice, but that's still life-changing. But we did not have anyone with ALS. We did have someone with fibromyalgia. There have been studies on fibromyalgia and mindfulness, and she had a voice disorder. Hers was caused by thyroid surgery, vocal paresis caused by thyroid surgery. It was very helpful for her, but no one with ALS.
Okay, good information, Catherine. I know there are several other questions, and due to the time, we're not going to be able to get to those. But as I said in my opening, we will get answers to those questions for you, and they will be part of the webinar and posted on our website at dysphonia.org. But Catherine, I'd like to just kind of wrap up with a question here. How do you, or can you give us a couple of examples of how we, people with voice disorders, can use mindfulness in everyday life?
Yes, absolutely. One of, any time you're sort of bringing yourself in touch with your senses, that is a mindful awareness exercise. So, just checking in with your body and at any time. And if there's a particular place, your throat, for example, or your back where you tend to feel discomfort, just checking in with that. A lot of people find just by doing a regular physical check-in, and I'm talking like a 3-second body scan. What do I feel in my body? Boom. Just noticing that, you can take just a few little steps to prevent it from kind of escalating. So that's one of the most important things I'd say for people with muscle tension dysphonia, is just noticing where you are, noticing that tension, and then seeing if you can release it a little bit and continuing to check in like that.
Fantastic. Excellent information. We appreciate you very much and stepping forward and taking on the challenge of really developing your mindfulness courses for those of us living with all these different voice disorders. And so you have really put yourself out there. And that's one of the things that you talked about, and we see all the time with all of us with voice disorders. It's very difficult to do that. So thank you so much, and fantastic work, great research study that you did. And all I can do is just say thanks very, very much. Encourage you to continue your work and continue to help people with voice disorders, because you clearly are. So we appreciate it.
It's been an absolute privilege and a pleasure.
Yeah, thank you, Catherine. And we'll just close with remind all of our participants that our next webinar will be in January, on January 31st, and it will be a speaker talking about the ADA and workplace accommodations for employees with voice conditions. So mark your calendar, January 31st, and all the best to everyone, and happy holidays. Thank you.